So part 5, when is Medicare available? After disability ends or when an individual under age 65 returns to work. So this is looking at the back end of what we've been doing. For example, we were looking at how to get on Medicare, and now we're looking at what happens if someone is coming off of Medicare. So let's look first at when Medicare eligibility will end if an individual does not try to return to work. So when a person is no longer considered to be disabled under the Social Security Act or the Railroad Benefit Act, Medicare eligibility stops at the end of the month following the month of notification. Let me give you an example of that. If a person is no longer disabled and Medicare notifies them on November 15th that their coverage is ending, the coverage will actually end on December 31st. So it's the end of the month following the month of notification, unless the reason is that eligibility would end only because of work. So if the person is coming off of disability because they're going to work, then Medicare coverage may continue. So let's discuss Medicare eligibility for working individuals with disabilities. So I just want to outline the various steps. There is a trial work period that will be followed by 93 months after the end of the trial work period, which is then followed by an indefinite period following the 93 months. So there are 3 different components here that I will look at each one of these 3. But note that Medicare eligibility during each of these periods applies only when the individual continues to meet the medical standard for disability under Social Security rules. So let's look at the first component, the trial work period. An individual is entitled to continue Medicare during a 9-month trial work period, during any rolling 5-year time period. So if you're looking at 60 months and an individual, say, goes back to work for 3 months and then they're just not up to it, they can't sustain it, then they don't try to go back to work. But then they have 6 months left in their trial work period within a 5-year time period. So the 9 months do not have to be consecutive. The person could try on multiple occasions to try to go back to work. And then if 5 years elapses, that rolls, some of those months may roll on and roll off. So this is something that Social Security will be keeping tabs on to help a person if there's any question about what they've attempted and tried through the trial work period. An individual must have gross earnings of at least $810 per month in 2016, or work more than 80 hours of self-employment per month. Again, I would caution that this is a presumption, and that if it's a great deal more and a person can show that it really was only a few hours of something that they did, Social Security will take a look at that. But the ability to perform such work under a trial work period and under the typical provisions of the gross earnings amounts will not disqualify an individual from being considered disabled and from receiving Medicare. So following the trial work period, so an individual has satisfied their 9 months of working, and they still have the disabling impairment, but they meet or exceed substantial gainful activity, the SGA tests. They may continue to receive Medicare after the trial work period. So for 2016, the SGA monthly threshold is $1,130, and it's higher for an individual who is statutorily blind. But under these circumstances, Medicare may continue for as long as 93 months after the trial work period has ended. The importance in this, of course, is to create assistance and incentives for people to want to return to work, for people to try to return to work. And if they know that they can have the safety net, if you will, of Medicare coverage, it will really help them to make the attempt to return to work. So Medicare eligibility with indefinite access to Medicare. So this is, again, after the trial work period, after the extended period of eligibility, and now we're into the indefinite access to Medicare. So following the extended period of eligibility, working individuals may continue to receive benefits, Medicare benefits, as long as they are medically disabled, if they are under age 65 and they pay Part A and Part B premiums. So again, this is something that should be considered along with anything that may be available through the Affordable Care Act, through the exchanges in the states. There's a lot to consider with how much people are paying into Part A and Part B, and how that compares to what they may be able to obtain either through the fact that they're working or not. But it gives them, at least it's a considered option for people, and it's available for people as something that they can put out on the table and look at all of their options. So the Part A premium will depend on the quarters of work that an individual or a spouse has paid into Social Security. And the Qualified Disabled and Working Individual Program, which I discussed earlier, may also be available for low-income individuals to help to pay the Part A premiums.